Yeah, like,
Hello.
hi.
Long time no see.
Oh boy, welcome back, everybody. We're hoping that this actually starts making some progress.
Welcome to the Wait Here Please podcast. I'm one of your co-hosts, Sophie.
And I am Mariah.
And where have we been?
What has happened? What, it's been a month?
No, it's been more than a month.
Has
It's been
it?
more than a month, I feel like.
It's been a wild few weeks between your stuff with the accident. We've talked on that. Uh,
Hmm.
my stuff with a bunch of other moving pieces. And two kids and family in and out of town and everything else going on in life.
Yeah, it's been great. But we're really excited to be back with y'all. We are so sorry. We've been way away on hiatus. It was not planned. I promise you, it was not a planned
It was not,
hiatus whatsoever.
definitely not, but I'm glad that we are back up and running. Um, Hopefully getting caught up with all the stuff that we want to talk about and all the things that we were planning on talking about.
I know, we literally have like seven. Okay, that's, I was gonna say 700. That's a little dramatic. But we have a
You
lot.
dramatic?
Me dramatic? No.
What?
But we have a lot of exciting things, and
Mhm.
March is actually kind of a big month.
It has, yes, it is.
Now normally when it comes to awareness months, it's not like, I feel like the big one that you hear about all the time, but was it hasn't been really promoted in the NFL as much, is Breast Cancer Awareness Month in October.
Mhm.
But other than that, I feel like it's not like a nationwide thing. Like you don't see the commercials everywhere.
No.
You have to self-promote it if you're like passionate about it. Um, I don't know. Am I missing? Is there another awareness that you've noticed?
I know. No, I mean, LGBTQ is what is that? June?
I don't know. I don't think that's awareness.
Fair.
I think that's just celebration.
Yeah. And I know the ones, but again, it's because they're more personal to me. Like March is Social Worker Awareness Month, or Social Worker Month, Month of the Social Worker. I think March is also Month of the Military Child, which I know about because I was in the military. Uh,
Wait, they really, I had no idea. I've never heard that.
no, yeah, see. It's the stuff that, unless you're actively involved or promoting or anything, we don't quite hear about.
Yeah. So I think that it's really I wonder why.
Hmm.
Like, why is it just, but even like I said, like you don't really see Breast Cancer Awareness Month
No.
being promoted as much anymore. I mean, when was the last time you saw everyone wear pink for the NFL in October? A couple of years,
I
maybe?
think so. I mean, now they have what, the pink cleats or pink socks, stuff like that, but or even I think they put a pink ribbon on their uniforms.
Hmm.
Um, but it's not as big as it used to be. It doesn't feel like.
Yeah, it's more subtle,
Hmm.
which is bullshit, but what's new? So the reason why we're talking about Awareness Month
What's
is
that?
there's kind of a big awareness month that we want to kind of educate everyone on.
Hmm.
And it is actually Endometriosis Awareness Month.
Yes.
Endometriosis Awareness Month is from March 1st to March 31st.
Hmm.
And it is important because I have endometriosis.
Yes.
And I think that it is so important that everyone knows about it
Hmm.
because of how common it is, and yet no one knows about it, or they know about it, not talked about. It's not, I don't know. it's still not taken seriously, even though when
Right.
we get into why it needs to be taken seriously, you'll be
Mhm.
like, shocker.
Yeah.
But because it's Endometriosis Awareness Month, we felt like it was the perfect time to actually say like, hey, let's
Love
let's
it.
let's educate.
Let's make it an awareness because what are, I mean, it, even though we don't hear about it that often, it does impact a lot of different women, whether they're diagnosed or undiagnosed, because it takes a long time to get diagnosed with it, if you ever do.
Exactly. So here is some background on where Endometriosis Awareness Month came from. Endometriosis was Awareness Month was founded by Mary Lou Balwig, President, Executive Director, and the founder of the Endometriosis Association. The ribbon color is yellow because every, ri- for whatever reason, every awareness has a ribbon,
Yes.
and the color for Endometriosis Awareness Month is yellow. Yellow was the color. This is a quote by Balwig. Yellow was the color already established as the color for endometriosis starting in 1980 with the publishing of her first popular yellow brochure. So, I guess it's always been yellow. It wasn't like, I guess it's just because of the brochure. I mean, I would have picked black, but that's different.
Tell us, why would you pick black?
Um, mm, I think when you, if you look up, so like how I think of endometriosis, I think of like the lesions.
Hmm.
And the lesions are, and I'll get into explaining what endometriosis is in a second, but the lesions are usually like black or
Okay.
blue-ish colors. And so I would do like the color of the lesions.
Yeah, fair enough.
Um, I think Breast Cancer Awareness Month is pink because
Women.
sexism. And pink is apparently the color for women,
Yeah.
even though it's any color, but it's fine. Um,
Okay.
so in 1993, Mary Lou Balwig says she was one of 8 women who founded an endometriosis awareness week during the Endometriosis Association's roundtable in Milwaukee. So
That's
that's like a little
fantastic.
background.
Yeah.
But let's get into it. So, Mariah,
Yes.
before meeting me, have you ever heard of endometriosis?
I mean, thinking back to it, I'm sure I did, right? I'm sure I heard about it somewhere, but it never really crossed my mind, right? As I mean, I have PCOS, so I know that there's a bunch of things and diagnoses that can impact women. Um, and there's not much education out there for us or awareness, I guess. So, I mean, did I hear of it? Yes. Did it cross my mind as much as it does now to become aware? No.
That's okay.
Yeah.
Nothing wrong with that. I mean,
Yep.
you don't know until it's presented in front of you.
Exactly.
So this is the definition. Now there's many definitions, but this is specifically from John Hopkins Medicine. It is endometriosis is derived from the word endometrium, which is the tissue that lines the uterus. Patients without endometriosis have endometrial type tissue outside of the uterus. Now, one thing that is quote unquote controversial is how to explain endometriosis to people or understanding endometriosis to people. Um, a lot of the times people are like, well, it's just endometriosis can only be found outside of your pelvic region. It can't go anywhere. That is not true. They have found endometriosis in people's brains. It spreads everywhere. Way, there's no stopping it. we don't know why or how it spreads that far.
Yeah, and when you were telling me about that, I think didn't it even mention that men can have this as well. Well, my
Exactly.
yeah.
Men can also have it. So there is also not a lot of research on why men can have it. Um, and so it's kind of like, well, how can like how does this spread? Like what happens? Endometrial tissue growing in these areas does not shed during a menstrual cycle like healthy endometrial tissue inside the uterus does. The buildup of normal tissue outside the uterus can lead to inflammation, scarring, and painful cysts. It can also lead up to the buildup of fibrous tissues between reproductive organs that causes them to stick together.
Okay.
Um, so for men, to be completely honest, I don't know how it spreads.
Yeah.
I think they're because men don't have their periods, I don't know how it would spread. Um, but also at the same time, even with women who have their periods or people with uteruses who have their periods, shedding like that seems to not just be the way to spread it.
Mm-hmm.
So I don't know. I really don't understand. I feel like because there's so many different definitions, it's very confusing and can be overwhelming. And I think what's frustrating is that there's so many definitions. Like when you think of, why is my eye tearing up? Like when you think of depression or
Mm-hmm.
anxiety, like there's one definition, that's it. It's confusing why for endometriosis there's so many. Like it doesn't make sense.
Yeah, and I could see that because, and I'm sure living in it, it's like, well, there's no true definite answer. Like there's still a lot of what ifs that you can't have an actual definition of it.
Yeah. So this one is why it's very frustrating for people who have endometriosis is because of how many people who have it. This is just what's been recorded, people who have been diagnosed. This does not include people who probably have it, have not been diagnosed.
Exactly.
So this is a rough estimate. I want to make that very clear. Endometriosis affects up to 10% of women and people with uteruses between the ages of 15 and 44. It most often occurs on or around reproductive organs in the pelvis or abdomen, including fallopian tubes, ligaments around the uterus. I'm going to butcher this. Uterosacral ligaments,
You got that
lining
right.
of the pelvic cavity, ovaries, outside surface of the uterus, space between the uterus and the rectum or bladder.
Mhm.
Um, that between the rectum and the bladder, that one's like a lot where people often get misdiagnosed with
Yeah.
IBS or stuff because they're like, there's no way there
Yes.
because it's so similar like symptoms to other illnesses, people don't think it's automatically endometriosis. They think it's something else, and that leads to a longer way of diagnosing the
Yeah.
problem.
Yeah.
More rarely, but it has been found, bladder, cervix, intestines, rectum, stomach, vagina, or vulva. Now, like I said, there has been some found in your brain, like that was kind of the most wild one. But according to this specific article from John Hopkins, everything will be listed in the description. They did not put that. So I want to make that
Yeah.
clear.
And like you said, it affects what 1 in 10, or as of what we know now with the diagnosing it, 1 out of 10 women have it. But also according to what was this resource? EndoBlack.org, it takes 6 to 10 years to be diagnosed. And for African American women and women of color, it may take 11 to 15 years for a diagnosis. So
Why do you think that is?
who knows? Wonder why. Because women aren't taken seriously, and then you add in certain colors, and
Yeah. I don't really, there is, for people who don't really understand why African American women and women of color are not taken as seriously as white women. There is this stupid myth that um, Anglo-Saxons created when they colonized the United States and created the United States, saying basically that Africans, when they enslaved them from taking them from Africa to here, that they did not have the same amount, that their pain threshold was higher, that they did not experience pain as quickly as white people.
Okay.
So that was their quote unquote excuse to one of them to cause inhumane torture.
Wow. See, I didn't know.
And yeah, so it stems all the way back from the creation
Mhm.
of the United States and colonization. And as for in general women of color, it strives off of that mentality. And that is why there is a higher mortality rate for African American women after they give birth than any other woman, because they are not taken seriously. There is this stigma that their pain is higher, which is bullshit. And it's just like that's the mentality
Yeah,
to
which
this
is,
day.
which, like you said, it's bullshit, you know? Yes, I'm white. And I'm also a human that recognizes that just because the color of our skin and genetics are a little different, that doesn't mean that we can handle pain differently. Um, and something I also talk with clients and other people in my life about of like just, going back to that white coat syndrome that we talked about, what was it, the prior um, pod, that so many women are afraid of speaking up because they're used to not being heard. They don't speak up because they kind of get steamrolled over, unfortunately. And I mean, I can even say that I've been there. It took me 6 years to be diagnosed with PCOS. During both of my births, I during my first birth, I didn't feel listened to as much. I came into my second one more knowledgeable, more capable of advocating for myself, but it was still also a challenging one to advocate because once you're in there, it's like, again, being steamrolled. Everyone thinks they know what's best. It's the medical way to handle it. When in reality, like certain things don't have to happen, or the the woman should be listened to about her own health.
Yeah, and the big issue that BIPOC women are experiencing is you could be advocating as much as possible
Mhm.
and they're still not listened to. There is a specific episode of one of the like ER, like, what is it called? You know, like those medical shows where it's this black woman who just had a baby.
Mhm.
Baby's healthy. But the husband noticed that she was in pain, and in her catheter, the color was a different color.
Mm.
And one of the residents was like trying to get the main doctor to help her. And they were like, she's fine, nothing's wrong, till it was too late and she died.
Yeah.
And that is unfortunately what is very common, specifically with African American women
Mhm.
in with their high mortality rates in 2025 in America.
Yeah.
And it's kind of insane that we're still experiencing this
Is it
and
though? Is
this
it?
change. I think for me, it's just like, well, now because people think science isn't real anymore.
That's
Um,
where I'm about. That's like what I'm feeling is like is it's insane because as women, as humans, as social workers, it's like, why is this still the thing? And then you look at our culture and our politics. and our medical system. And it's like, this is why it hasn't changed. We're all aware,
Mhm.
but I mean, it's not as asinine as it is because you can't, I mean,
Yeah. I mean, it's funny you kind of say that because um one of my favorite movies of all time is called 42. It's about Jackie Robinson. If y'all haven't seen it, highly recommend. Chadwick Boseman, rest in peace. He plays Jackie Robinson. And in this, there's a specific scene where this guy is talking about how Jackie Robinson, he's faster than all the other white baseball players because of his heel and the way his heel is. And a second later, he hits a home run.
mm,
And everyone in the press box is laughing at that dumbass. And it's like, so that has to do with his heel too?
hmm, yep,
It's just, it's stupid. Like, it's so stupid. But people think like that.
hmm,
And unfortunately, BIPOC people are constantly put on the back burner, are constantly suffering even more. I
yep,
mean, the fact that 1 out of 11 women have endometriosis, but it takes the most 11 to 15 years for a BIPOC person to be diagnosed is absolutely insane.
that is, that is.
That's,
That's
I don't
why.
know, I don't understand fractions, but that's a long time. That's a long time.
If you think about that, because yes, it doesn't have to do with periods, right? You know, the average, I mean, average period is what, anywhere between like 10 and 16 at this point. You think by the time
Like
people,
age, what do you mean?
like when they get their periods,
Hmm.
like having symptoms
Oh, okay.
of like the shedding or not shedding, like that's around the average time that I'm aware of that like women start, or people with uteruses,
Uterus.
uter uteruses are starting to feel the pain and the other symptoms that it's just your period, this is what's happening. By the time we're out of college, if you go to college, by the time you're in your 30s, if we're looking at least statistics, is the time that we're getting diagnosed. We are suffering as women for, I mean, what's the median? 10-ish years of we don't know what's going on. This is just your period.
Yeah. And one thing, the reason why I thought this specific quote was important was
Mhm.
because of the mindset that it's just a period disease. It's not. This is from a specific physician. I'll put the link in the description box. But she specifically said endometriosis is not just a disorder of pain, but it absolutely affects the patient's entire life. It is a multifaceted disease that influences and is influenced by overall health, lifestyle, family planning, financial resources, and more, and requires a multidisciplinary care team to manage.
Mhm.
So for me, when I first was diagnosed with endometriosis, I was 15. Um, I had a two person team. It was a psychiatrist because it does affect your mental health,
Mhm.
and then my gynecologist for my endometriosis. Then they add on other people. So the pain clinic. Then they add on a nutritionist because most of the time you're either losing weight or gaining weight. For
Mhm.
me, I gained weight. Um, then they add on various things, maybe therapy or family therapy, because family members do not know how to support that individual
Exactly.
during these times. Um, Financial resources, that's a really big thing. I mean, transportation to the doctor's office. Most of the time, you cannot go to your PCP. You have to go to a specialist.
Yeah.
Most of the time, these specialists are not close by. These specialists are pretty far, especially if you are in rural areas. So all of these things add up. And don't even get me started about medication
Uh,
and the price of medication. And now with the destruction, the rampant destruction that this Trump regime is going on, like medication is already hiked up. I
oh
mean,
yeah,
you know,
medication's already so increased, and I couldn't imagine. We go back to that financial aspect that this impacts. We're thinking of not just pain management meds, it's birth control or hormones to kind of help manage it. It's the copays to meet with the specialist and get whatever scans need to happen.
copays are dumb.
Yep. The psychologist, the psychiatrist,
Mhm.
um, s- I don't know if I said scans.
Yeah.
When you're in pain, it's hard to work. Um, then you think about having a uterus, you're also pads and other feminine products. Um, all of this, like it's a huge financial impact.
Yeah. And then if you're a parent of a child who has endometriosis, that is an added burden. So for me, because I was 15, my mom or my dad would have to stay home with me. And one thing that wasn't discussed in that specific quote was the lack of resource in schools
Yeah.
and the lack of support in schools. I'll never forget how horrible my school treated me.
Mm.
Now, I think that I have various feelings. I really don't know if it's because I'm Spanish and my school, even though most of the kids were Spanish,
Mhm.
but the administration was white. There was like, I don't even know how, had to be less than 10 BIPOC people. So most of the kids are Brazilian, Spanish, some white kids, but mainly the administration is white. So I don't know if it's because there was systemic racism, I'm not sure. But
Yeah.
I'll never forget the amount of times they told my mom, she's lying to you. Your daughter is lying to you. She's not really that sick. She's just taking advantage of you. And the amount of times my mom was like, what the fuck are you talking about? My daughter's in
Oh no.
pain. Take her fucking seriously. Like, cut the shit out. And it got so bad that there was a specific meeting. There was a specific meeting where this was after I was diagnosed. This was after I was diagnosed. We had all the paperwork where they were like, well, she had her surgery. Why is it she should be fine now? And my mom was so disgusted.
Mhm.
It's like, okay, but she's still in pain. You're refusing to give her tutoring, which is illegal, by the way. Although now with the destruction of Department of Education, who the fuck knows?
Who knows what's
Well,
going to
that's a
happen with
story
that?
for a different day.
Yeah, let's
Um,
not go down that path because we will be here legit all day at this point.
but at the time, that was illegal. They did
Mhm.
not give me a tutor, so
Mhm.
I had to go to summer school.
Yeah.
And so I didn't, so the added stress of having endometriosis when you are a child is extreme, with the lack of supports from your school is
Yeah.
very, very hard
I was about to
because
say, it sounds like they kind of defined you as like the problem child, the problem student in class, like just
100%.
making stuff up to get out of the work to, yeah.
And then I had gained 60 pounds because I was not able to get out of bed. The medicines we were trying, and for me personally, food is how I cope. So that also,
Yeah.
but I'll never forget that there was a rumor that I was pregnant because I had been out so much and because I had gained so much weight. There was a rumor going around that I was pregnant. Um, and I think that also caused a lot of isolation from me and other students
Mhm.
because I stopped being able to connect with these people that I had been in school with. And I'll never forget with Twitter, people would be like, oh, I don't want to go to school today, blah, blah, blah. And I would be like sobbing in the bed in pain and be like, I want to be in school.
But you
Like,
just
I
can't.
want to live a normal life. But that is the problem with endometriosis. And that is why in the previous episode, I asked you about school nurses. And
Yeah.
this is why specifically I have beef with school nurses, why I think school nurses in particular need to be educated on endometriosis
Yeah.
and PCOS specifically because they can support. Because I was constantly sent back to class. I'll never
Yeah.
forget. I was in theater and they turned their complete back on me. And I'll never forget one of the teachers threatened me, quote unquote threatened me. She was like, if you don't get up and do the activity, I'm calling the principal. And so I like was hunched over, grabbing my stomach, sobbing, and having to participate. So it's just it shows now this was be 2013, 2014.
Okay.
Could it have changed? Maybe.
Maybe.
From working with teenagers though, personally, you have worked with them, I've worked with schools. I personally do not think so. If
I
I'm
if
wrong,
anything, I
please
feel
let
like
us
it's gotten
know.
worse of now that, some of these learning disabilities are even being talked about. ADHD, autism is a big one. ODD, for example,
What's
from
ODD for people who don't know?
oppositional defiance disorder. Um, a lot of what I'm seeing working with the kids I work with and in the schools is that all these teachers, oh, this child's acting out just because they're oppositional. They don't want to follow the rules. When they might have an IEP or something saying like they have ADHD or even anxiety, the schools are just, oh, you don't fit in. You're the problem child. You don't want to be here. And, you bring in medical stuff and it kind of still just goes over their head. So I don't think the schools have gotten any better, at least with my knowledge and who I work with handling any of this because there's just like, oh, well, your problem, go sit down, go deal with it. That's really how it ends.
And that's what's I think confusing to me because I mean, when you become a teacher, like that's like you become a teacher because you love school.
You're
You
not in
love
it
to
for the money.
teach. Yeah, exactly. You're not in it for the money. So it's like very confusing why you are so rude and mean to these kids
Yep.
who are, I mean, especially now, like I can't even imagine what it's like being a kid.
No, you think of the kids that especially we are seeing, like they went through COVID. They went through that kind of social isolation for a little bit of their not college years, their educational years. Um, the way that they're interacting now is so different.
Yeah.
And as a
Yeah.
teacher, I couldn't imagine going in there being like, just sit down and shut up and follow the rules. Like,
Right.
have some compassion, have some empathy for the kids that you went to school and got a degree and are thousands of dollars in debt. Go help them. Don't just expect them to be little sheep either.
And that's why for me, I think I'm very tainted
Hmm.
because of my high school experience. I think I'm very tainted. I think that I have a very, I mean, compared to like even both of us, my views on things are a lot more quote unquote radical than yours. But
Yeah.
I think it's because of constantly being told we don't believe you.
Yeah.
You're lying to your mom.
Yeah.
It's all in your head.
Exactly.
You're overreacting.
Hmm.
And the thing is, it's just like, let's play the flip card then. Who says, okay, let's say I am overreacting. There is always a reason.
And
This is,
what is that reason?
and
Like,
this is the social work mindset.
yeah, even if it wasn't the pain, what is going on at home? What is going on in your life that you don't
Mhm.
wanna be in class? There's
Mhm.
something.
Kids do not behave this way for nothing.
No. They're looking for something. They're in need of something. There's so much going on that kids don't just act out for shits and giggles.
So for doctors, for teachers, for anyone to say, to kind of push you aside, it's like, okay, it was a very lonely time. And I'm very grateful for my mom and my dad and my brother for being supportive of me. Um, but it was a very, very lonely time. And I do think like that's why I'm very awkward. I have a lot of social issues that I can honestly kind of relate to the kids who were in COVID during their education because of the isolation.
You were isolated.
Um, and I think that's one of the things I would love for with more awareness is more social groups regarding endometriosis
Yeah.
for kids and teenagers.
Right.
Um, I think I don't know, it's just it still boggles my mind that it's 2025 and there really has not been much of a change
There hasn't.
or been any improvement. I mean,
They're working on something though. I remember
yeah, but
you
with the frozen funds, I mean, I
yeah,
don't think
who
so.
knows where that's gonna go, or even, I mean, we talk about big farm. Is this gonna go anywhere? Because they are making bank off of this diagnosis. So if we catch it early enough, will as much money be going into the system as they want?
Exactly. So I talked about some of my symptoms, but I also want to talk about some symptoms that like other people may have as well. These are kind of the quote unquote warning signs. Chronic pelvic pain, painful periods, pain during or after sex, heavy period, period doesn't end, pain during bowel movements, pain while going pee, pain going down your legs, back pain. These are the other symptoms that have nothing to do with your pelvic area. Depression, anxiety, fatigue, hypersensitivity to pain. That is known as central pain sensitization. They can't make these harder to say, geez. Um, Brain fog and infertility.
Mhm.
And I want to speak more on infertility because that's something that is probably one of the most misinformed parts about endometriosis. For the longest time, people were saying to women and people with uteruses, if you get pregnant and have your baby, you will not have endometriosis.
Yeah. Yep.
That was the medicine. That's a lie. That's not true. You can still have endometriosis even after you give birth. Um, I think saying that to a 15-year-old is gross
Yes.
and inappropriate.
Yeah, or even that fear at that point too of, you talk about infertility, society puts on women like, "Oh, you're gonna be moms, you're gonna have
Yeah.
babies," all this stuff, and putting that thought into a young female or a person with a uterus and saying like, "You can't have children."
Mhm.
That is mentally a big thing, and I mean, when I was 21, from my own personal experience, I don't have endo, but have PCOS. I was told, "You're not gonna be able to have children biologically.
Mhm.
You're gonna have to do IVF. You're gonna have to do all the hormones, look at adoption or fostering or a surrogate." This none of and here I am with 2 kids with none of that.
Yeah.
Um, like, yes, does it put you at higher risk for fertility? Yeah. And there's stuff that can help you work through it or get through it, or there's other options. It's just not, oh, you can never have children. There are other ways. And I think that's
But the problem with the other ways is they're not free.
Exactly. Yep.
I mean, even which I didn't know actually,
Really.
adoption fees.
Hmm. If
So
you go through states, at least here, it's a lot cheaper. But if you like do other things,
yeah,
yeah.
so I think that's the thing. I don't know. I think phrasing in medical areas is also very challenging too. I
Mhm.
mean, like telling like I think for me when I was first told like you're probably never gonna have kids, um it I don't I think I really don't remember how I reacted.
Mm,
I think it was more like I was so desperate for the pain to go away that that didn't matter.
that didn't matter to you.
But at the same time I was 15.
So there's that difference when like I was 21 being told you're not going to have kids. I felt like I lost my womanhood. I felt like I'm not a woman because I can't have children. Something's wrong with me. Something's wrong with my reproductive organs, so I can never have kids, which makes me less of a woman. And I mean, people that I know who have survived breast cancer, who have had to get mastectomies, they also lose that kind of womanhood identity because you've lost a piece of you. But
Right.
yeah, I could see how you were 15. You just wanted to get through the pain. You
Right.
weren't thinking at that point, you weren't thinking, oh, I want kids now kind of thing. You're just like, just make the pain go away.
Yeah, and there was discussion about getting a hysterectomy,
Mhm.
which I would also like to note does not stop
I was
endometriosis.
about to say, does that
Endometriosis
stop it
can
though?
go because it spreads in different areas.
Mhm.
Getting a hysterectomy would not stop the
No.
endometriosis. Another misinformation.
Yeah.
So I think for me, I have a very different outlook on children and having kids, and IVF, and I have a very different outlook. I think because I was so young when that was, in a sense, kind of taken away from me. I mean, that idea. Once you tell a child you probably won't have kids, okay, that kind of really changes things. I
Yeah.
mean, that's my personal experience. I could be wrong. Some people may be like, no, that made me like even more passionate, even more want to be a parent.
Hmm.
I don't know, but
Yeah.
I know a lot of people in the Spoonie endometriosis community, especially on Instagram, a lot of
For
them
people
want
who
to.
don't know, can you tell us what Spoonie is?
Spoonie is a based off of the spoon theory. The
Hmm.
spoon theory is you have a certain amount of spoons throughout the day. For people with chronic pain, you every time you use up any energy or use or do an action, a spoon or multiple spoons gets taken away. By the end or even half the day, not even maybe even the morning, you have no spoons left to the point when you're exhausted, you're in pain.
Hmm.
So, for example, I could have quote unquote 10 spoons today, but because it's raining today, then I've already lost 5 spoons. So, spoonie is just like the adjective. Is that it?
Yeah. Yeah. That's it. I don't know.
Uh, I'm so sorry to my English teachers. The adjective to the name
Same.
to talk about a person.
Okay.
Um,
Yeah.
but a lot of people in the endometriosis spoonie community in Instagram, a
Hmm.
lot of them want kids.
Yeah.
Um, I think also for me personally, I'm very scared of raising a child when I have a flare up.
Yeah. I
I
could
think
imagine.
that's the biggest thing. It's like I would never want to have, and this is me personally, I would never want to have my child see me in such severe pain and be like, why can't mommy get out of bed? Or why is mommy crying so much? Like, I personally, that is my fear. And with everything that's been going on with my health, I'm more and more considering probably not having kids for the safety of their well-being. Even though
That's
I've
nice.
always wanted to be a mom.
Hey, you've got mine. You can borrow them.
Yes, by the way, I am Mariah's guide kids parents. No. What is it?
Godparent, godmother.
Yeah. I'm
Okay.
Mariah's guide mom. No,
Well,
I don't know how to say it. You say it.
my kid's guide mom, and
Yeah.
I'm too old for that. It's just
Um,
my sanity in times.
yeah. So basically, um, so I have Mariah's kiddos, but I just don't, for me personally, that's my fear. But it's really nice seeing people who have endometriosis or PCOS want children and end up successful. Like it's very inspiring. It's very hopeful. It's
Yeah,
just for me personally, I can't. I'm very scared.
understandable. Yeah, I couldn't. I mean, I only know what that's like from like me being sick and then still needing to be a mom. Of when I just want to lay in bed and my partner is working and I'm home with the kids. It's like, just leave me alone. But you have to be, especially when they're younger, you have to be there. They're relying on you. So I can definitely understand that. And I couldn't imagine the pain that comes along with it.
Yeah. So I think that when doctors come to clients, in particular discussing infertility, I really wish they would have an infertility doctor with them
Yeah. Yeah.
to explain or even training
Yeah.
by an infertility doctor, just to explain through compassion rather than just like you're infertile.
Exactly. Like, let's work on our bedside manner with this stuff because it is a big deal. It is a big deal on a society that puts this kind of pressure on women of, oh, when are you going to have kids? When are you going to get married? When are you going to do this? When are you going to do that? So, like, making your bedside manner a little bit better, be more educated, have that specialist there or a resource, something to give to the person that you're talking to.
Right. And that also goes along just with doctors in general. Now, I feel like Mariah and I know burnout very well considering we're social workers and we are underpaid for what we do.
Hmm.
Doctors are not underpaid. I'd like to emphasize that. They have more supports than social workers.
They do.
But I do want to acknowledge they are burnt out.
They
And
do. Oh, yeah.
more and more people are not going into the medical field because of everything going on. But at the same time, I think we need to also acknowledge that doctors need to specifically learn how to spot endometriosis.
Hmm.
Um, Endometriosis is commonly missed or misdiagnosed because of the lack of understanding surrounding presentation,
Hmm.
cycle, cycil, what do you say? So
Cyclical.
cyclical pain.
Cyclical. Yes.
I think what that means is like your cycle pain, like when
Yeah.
you're in your cycle.
Like pain. Yeah. That's constantly coming and going.
Yeah.
Yeah.
And it's similar as with other diseases. Like I said, people who have endometriosis on their bowels, they're often their bladder, they're often misdiagnosed. Dr. Hawkins notes that endometriosis is commonly clinically misdiagnosed as diseases such as polycystic ovarian syndrome,
Hmm.
PCOS, irritable bowel syndrome, IBS, pelvic inflammatory disease, or fibroids. Now, the reason why it's really a big deal that it's misdiagnosed is because they're not getting the right treatment.
Yeah.
Now,
Exactly.
if Mariah takes the medicine I take, it's gonna affect her differently than if
Hmm.
I take Mariah's medication for her PCOS.
Yep.
It's not gonna stop my specific symptoms
Exactly.
because it's not made.
Yeah. You think about I mean, somebody with depression versus somebody with anxiety, for example. Medications are very similar, but if you give somebody the wrong medication or one that doesn't fit their symptoms, it could lead to worsening of symptoms. It could lead to suicidality. It could lead to so many different things. And those diagnoses are very similar, but it's just dependent on what's actually going on inside of the body. That is what's needed.
Right, exactly. And so I think it's just really important that we educate
Hmm.
all doctors, not just gynecologists,
Yes.
because we don't just go straight to our gynecologist, especially when you are a child. You go to your PCP, you go to the emergency room. There's
Mhm.
so many different steps before you finally reach a specialist. When you're an adult, it's a little bit easier.
A little bit. Even though most of these specialists still require a referral from your doctor. So our PCPs, our general practitioners, definitely needs more education around, oh, this isn't just sciatic pain. This isn't just IBS. This is a kidney infection. Like if it's cyclical, if it's happening frequently, let's refer her to somebody else or
Right.
him, somebody else, them.
So, and I think also one thing that I think is really important is how you diagnose endometriosis.
Mhm.
There's a lot of misinformation that you can see endometriosis through getting an MRI or an
Mhm.
internal ultrasound. Now, an internal ultrasound, for people who don't know, is literally you take a long fucking ass stick, you lube it up, and shove it up your vagina. There
Not a
is
stick.
nothing,
It's a wand. It is not a piece of wood.
it's a fucking stick, and it's uncomfortable, and I highly hate it.
It's yeah, it's
Not comfortable.
no. It's not like a not something that's supposed to be up there, like, a sex toy or anything like that. It's not like that.
Honestly, and can they get lube warmers? Jesus Christ, it's always so fucking cold.
You don't get lube warmers? Oh,
No, every
man.
place is different. It sucks. That's why it needs universal. It's universal. But yeah, you cannot be diagnosed that way.
No.
I want to make
I'm
that very
sure
clear.
I'm sure that they can see something at that point, but
Depending though.
yeah, oh, depending on
So
what
the
location.
reason why it depends is because there's four different stages. There's stage one, there's stage two, there's stage three, and there's stage four.
Okay.
Now, stage one is what I have. Stage one is very mild, and then it goes up to
Yours is
stage
mild.
five.
What you go through is mild.
Well, here's the thing, just because you are in different stages, you may have different pain. So people who have stage four, they may not experience any pain.
Oh,
So
okay.
they may not even know they have endometriosis. So that's the thing with endometriosis is your pain symptoms do not connect with the stage you are in.
Wow.
So that's why it is so vital. The only way you can actually be diagnosed is through laparoscopy. Now, laparoscopy is a very small, quote unquote small. I think any surgery is a big deal, but whatever. Where they go in your belly button, they go on your pelvic bone above your pelvis, they go also on the sides on your hip bones,
Okay.
and with like very small, um, not needles, but like small points and small microscopes. And
Mm-hmm.
that's how they go. There's two different types of ways to get quote unquote rid of endometriosis. So there's two different forms of how you get rid of endometriosis. There's excision, which is you cut out the tissue,
Mm-hmm.
and then there's ablation, which is destroying the tissue. Here's the thing. So for I've had four surgeries.
Well, ablations.
So that's the thing. The number one rule now we know is
Mm-hmm.
to always do excision to cut it out. The reason why is because you're cutting the roots out of your the area.
Okay.
Ablation means it can grow back because you're only burning the surface of the endometriosis, but
Okay.
the roots where it spreads is still
Yeah.
underneath.
Oh, okay.
So that's why you have to cut it out, because you have to cut underneath and get the root of the disease out. That's how I kind of think of
Yeah.
it.
And that makes sense. And then do you know if it's like, cancer where you can remove it, if there's a chance for it to come back?
For what? Which one?
for
Just like in general?
like the excision one. If you, I'm gonna say exercise, but that's not.
Um, so for excision, that seems to be like the number one, the golden surgery. It seems like in if you go to that specific spot, it's very rare, but as a whole, endometriosis can always grow back. That's because there's no cure. That's because you have to be on top of it
Hmm.
and make sure you're taking your medicine, taking care of everything. Um, but overall, as a whole, I can't promise that it won't grow back, but if you have excision surgery, there's a less likely chance it would than if you have ablation. And so
That
for
makes
me,
sense.
I had 3 ablation surgeries and 1 excision surgery. Now, the reason why I say laparoscopic surgeries are still a big deal is because they are presented as, oh, you'll be fine. You'll recover right
It's not
after. And that's not necessarily the case because one, no one knows what they're going to find until they go in there because, like I said, you can't always see through an ultrasound
Mhm.
or an MRI. Also, on top of that, what's really important is that they're still cutting out or taking or burning part of your body. So
Yeah,
your body responds differently. Everyone's body responds differently. And I think how it was presented to me on how to get better faster was not as quickly as how it should have been.
yeah.
So here is Sophie's tips on how to get better faster from recovery when you have a laparoscopy. Now, I cannot say this about having a laparoscopy regarding a hysterectomy. This
Mm.
is just for endometriosis.
It's just for you. Yeah.
Number one thing, the anesthesia goes straight to your shoulder. So the gas from the anesthesia goes straight to your shoulder, and you wake up with extreme shoulder pain. Sometimes the shoulder pain is actually worse than your incisions. So the biggest recommendation they say is you have to move. What they don't always say is how often.
Mhm.
So I got it down to a science. You have to move, and by move I mean you have to like walk the length of a hallway in your home or your apartment every 15 minutes
Wow.
because you have to get your body moving. You have to get the gas out because it's stuck in your shoulder and it's really hard.
Yeah.
So my biggest recommendation is you always move. It really changes how fast you recover.
Mhm.
Um the first few days, especially with excision surgery, it's a lot harder to move. So you might want to do every hour. But if you can move every 15 to 30 minutes, I really recommend it. The
Mhm.
first few days are very vital to your further on recovery. Some people it takes over a year to fully recover. But that's also depends on one, what stage they have, two, where is it,
Mhm.
three, how much do they find. So I think it's also important that people acknowledge that it's not talked about, but I do want to acknowledge like everyone's process and recovery is very different.
Mhm.
But the one thing that I have found is moving, and every time I recommend it to anyone, they say that is the most vital thing that helped them recover
Okay.
faster is moving. So that's my biggest tip. And so these are the things doctors should know.
Yeah,
I
very
should
simple
not have to go to Instagram.
to find the resources, find the tips, find the support. Like it should be
Right.
provided at the doctor's minimal.
Yeah, like I mean, you're getting a copay, you're getting payment
Mhm.
from the insurance, you're getting payment from the hospital. Like what? Come on.
Just help. Just advocate. Just provide something other than a 5 minute, you're fine. Five
Right.
minute, okay, we're good kind of situation.
Exactly.
Yeah.
So I think that in regards to why Endometriosis Awareness Month should be honestly more nationwide, more awareness, is because how many people it impacts.
Yeah.
I mean, now I saw this on Instagram, so let's take this with a grain of salt. But I saw something that says now they're saying 1 out of 7
Yeah,
women.
I could see it. Because like
And
your periods, your cyclical things, you shouldn't be in pain that much. You shouldn't. It's not normal. It's not normal to have pain monthly, weekly, things like that. It's not normal.
and I also wonder if like the stress of everything going on in the world
Mm,
probably has something to do with it.
absolutely. Yeah.
COVID. If you live in America, we're currently in a fascist regime, like a lot of things happening. So
Mhm.
I think that stress probably is causing an increase.
But yeah, I could see it.
Or people are just actually finally being taken seriously. That's the other thing. I don't
Hopefully.
know. I don't know.
I don't know. Hopefully we're starting to be taken seriously. Hopefully.
It's a good hope. Uh,
I try to be hopeful.
I don't. This is why
We're winning.
we're yin and yang. I'm completely opposite. I'm
Yeah.
the what's it called? The half night half glass full, half glass empty.
You're the half glass empty.
I've never understood that. I think it makes no sense. I feel like the yin and yang makes sense.
It
That one's
does.
like the yin is nice. Wait, which one's the yin? Is that the white part or the black part? I'm the negative part. Whatever that one is. That's me.
That's you.
That's me.
But you have some positive in you.
Depends on the day. No,
Yeah.
not even the day. Depends on the topic.
Yeah. Yes. Yes, it
But
does. Yes.
I think that why I kind of lost my train of thought. I forget what I was going to say.
I forget too.
But this is the thing. Like, this is why awareness is so important because we're guessing. We're guessing on why there's an increase. We really don't know.
We don't know. And it could be
Um,
so many different things. It could be, people not eating as good or all the stuff that's added to foods now. It could, who knows? Who
lack of
knows what could be
vaccination.
causing this?
Please get your vaccines, people. Please. I'm begging
Please.
you.
Please. Please
Think
get
of others for once. But yeah, no, I don't know. And
yeah.
unfortunately, with everything going on, I don't think we're gonna know for a while.
I don't think so either.
So this is the only way we can sh spread it, spread
Yes.
the awareness is
Yeah.
by talking about it.
By talking about it. Don't be afraid of talking about the stuff that might make you or others uncomfortable. Don't be
Right.
afraid. You got to talk about it.
And here's something that I don't think is talked about enough. If you're not happy with your doctor, leave. Find
If you're
a new
able
doctor.
to. If you're
But
able
here's
to.
the thing, even if you're in the same, you can ask for a different doctor in the same building.
Yes.
So like if you're in, unless you're in and I do want to acknowledge if you are in a reservation,
Hmm.
you may only have one doctor. So that's a lot harder
Yeah.
than if you are in a metropolitan area where you
Yeah.
have very a much bigger variety.
Yeah.
So that is a good point.
Yeah.
But
Because some
so
of
if
them
you're
too,
able,
I know here there's a lot of doctors that are on wait lists. Um, and a lot of the agencies also won't allow you to switch doctors and within the same company, especially if they're in the same building because it's
agency
like
or what is that the company or
it's
insurance?
the company.
What's what like the building?
Yeah, like the building.
Okay.
Like so say you go to see Dr. A at this practice at this
Mm-hmm.
location and you don't like Dr. A, you're like, can I see somebody else? Some organizations won't allow it because it could hurt Dr. A's feelings that you don't want to see them.
Please tell me you're joking.
I wish I was joking.
That's a fucking joke.
Mhm.
Who gives a fuck about Dr. A? Dr. A wasn't caring about my feelings.
Well, you know,
That's insane. Oh my
yes.
God.
Yeah, yeah,
Meanwhile, let me just emphasize how it works in social work land. If the client doesn't like you, they can fire your ass.
yep.
And social workers' feelings don't matter.
They
Honestly,
don't,
like for us, like we don't care. Like our goal is like the client matters. Like we want
yeah.
what's best for the
And
client.
that, I mean, yeah, I have that conversation with my client. If we don't fit, then we don't fit. That,
Exactly.
I'll refer you out. This is about you.
Exactly. So
Yeah.
I think for me that mentality is very silly.
It is. It is because it just makes sense. If we're not connecting, stuff's not going to happen. It's the same thing with my OB or my doctor. If we're not connecting, I don't want you touching on me. No.
Right. Like if I don't feel heard, why
Yeah,
would I go to
exactly.
you?
Yep.
Like one thing you constantly hear is, I don't want to go to my PCP because they never listen to me. Like that's something you shouldn't hear. So
No.
I think if that's some
I mean, the only area I think that's acceptable is your dentist. Like, I don't
your
want to go to
dentist.
I don't want to go to the dentist because I hate the dentist.
I could care
Hate
less
the
about the
dentist.
dentist.
Like, it's not that they don't listen. I just don't like the dentist.
I don't think
Uh,
they can listen. They have their hands in your mouth. Like,
yeah.
like what do
And
you
yet they
mean?
still try to talk to you.
Does this hurt? What'd you say?
Exactly. Like the only area, in my opinion, that's not something because they don't have to listen.
That's
It's
so
your teeth.
nice. That's so nice.
But I hate the dentist, regardless of who I see. I've had some really good dentists.
Right.
I still hate the dentist.
Yeah, that's what I don't understand. Like, like that's a very common fear. People's fear
It
of the
is.
dentist.
It is.
Um,
And I don't know why or where it comes from, but that's something else we can go
I just
down.
think, I think, I feel like you should be more afraid of people touching your vagina or your penis. But that's just me.
But like you're in my mouth,
Your private area is so much worse, in my opinion.
but you're in my mouth.
Private area, like this is where, this is why I don't understand. I don't understand the logic.
Because you can legit, I don't know. I don't know. You're in my mouth. I can't say stuff. Maybe that's why and then the noises. I don't like the noises.
The noise, that's fair. I wish, and even if you wear like earplugs
Hmm.
or like headphones, you can still hear like your inner
You can
monologue,
feel like the
your inner
scraping.
gargles. Yeah.
Yeah, no.
No, that's
So that's
fair.
another one. Yeah,
That's fair. But I still think like that air, the private area is 20 times worse, but it's
probably. But no, fuck the doctor. Fuck the dentist.
fine. Yeah. But I think that if you are able to,
Hmm.
and you are not connecting with your
Yeah.
doctor, and you are saying, I'm having severe pain, it happens every time I have my period, or I have not stopped bleeding in 3 months,
Hmm.
maybe find a new doctor. Even
Get
go to
on.
urgent care if
Yeah.
there is one. Like someone that can hear you. Because if
Exactly.
one person can hear you, they can write a note. There's documentation ready, and they can start. That can be the starting point. We
Hmm.
have to start somewhere. But I did not know that Dr. A's feelings were more important than my vagina, but
They
that's
are.
new.
They are. I mean, we got to care about the doctors. And I know it. They go through a lot of education. They're doctors. They deserve that
I'm
type.
sorry. Why are we? No, stop it. No. Social workers go through a lot of education, and
Okay,
social workers go through a lot.
I
And we are
agree.
not respected as much as doctors when we
I
should.
agree.
What are you talking about?
But are doctors actually respected or are they just feared?
Respected. If I
Mm,
tell you I have a PhD and I'm a doctor, wow, that means you're really smart.
but see, I don't see that. Maybe that's because I,
But like you have a different view of
yeah,
education.
yeah.
Education has been like in America
Because
specifically,
you can still get a doctorate
I
or
know.
PhD
I know, but
and
some
have
people,
like and almost fail classes.
I know. I'm just telling you.
Uh-huh.
I think it's more to do with if you like now, if you want to quote unquote succeed in America, you need to have this and this.
Yeah.
And it's all through education. It is considered not being successful, which I think is bullshit, if you don't have an education.
Uh-huh.
So I think it's more to do with the fact that they have the highest quote unquote education, even though, in my opinion, social workers should just get as high as respect as lawyers and doctors.
Yeah, but we kidnap kids. Come on now. That's all we do.
Listen, listen.
Anywho, because yeah, another topic we can go on
As
for.
you can tell, this is how Mariah and I's conversations always start.
Yeah.
We start with one topic, we go to another, and then Mariah says one thing, or I say another, and then we go to another. This is literally our text chains. So,
It
welcome
is.
to our friendship.
Yeah. Yeah. I will go to bed and I will wake up to 5 different topics from this.
Mhm.
I'm like, I don't even know which one to respond to. So I pick one and I just, yep.
Yeah,
Yeah.
yeah. That's when you know you found your person.
Yes.
But literally, I hope this was helpful. Like, that is the goal of Wait Here, Please,
Yes.
to spread correct information, to
Yes.
talk about things people don't talk about. And from our experience,
Mm-hmm.
um, I looked up when PCOS Awareness Month is. That is in September.
Okay.
So in September, it's your month, baby.
Oh, fun.
Um, and yeah, there's so here's a sneak peek on what's next episode.
Yeah.
So, oh my God, 1 second, Olaf. Your baby.
That's the only child Sophie will ever have right
That's a
there.
lie. I'll have other pets. What are you talking about? Your baby. So, if some of you don't know, one of the main reasons we were out is I got into a car accident and I sustained a concussion. And this was my second concussion. And apparently, another awareness month was Brain Injury Awareness Month.
Coming for you.
So, our next, I'm hoping that we can have it out in March. It might be in the beginning of April, but that's going to be the next thing because I cannot wait for y'all to hear how women are treated regarding brain injuries because, dear Lord.
You know it firsthand now.
No, this is my second one.
I said you
But,
know it firsthand.
oh,
So
oh, I get what you're saying. I get what you're saying.
it's the brain injury is still there, folks.
Dude. And that's the thing. But that's a little sneak peek on our second episode.
And I've told her, don't tell me a lot of the stuff so that it's a
She
surprise.
knows nothing
I know nothing.
about what
I
um
know about brain injuries and stuff like that.
mhm.
I've, being in the career field, and then my brother had a crap ton of
I'm
concussions.
sorry, we're not talking about it. That's for next
I'm
time.
just saying I have knowledge too, ma'am.
When I say you don't know anything, she doesn't know what I put in our notion.
No,
That's
I
what
don't.
I meant.
I
I
don't.
apologize.
Yes,
She
I
knows
have
because she
knowledge.
has had her own concussions.
Yes, and have a partner who has had a TBI. So I know, yeah, we're there. Um,
We are there. So that is going to be our next episode.
Yay.
If you have any experience regarding endometriosis, have endometriosis, want to kind of talk about endometriosis, feel free to reach out. Our goal is to educate, our goal is to help. If you think you may have endometriosis, but for whatever reason you're scared to look up
Mm-hmm.
or talk to your doctor, ask.
Yep.
I mean, we are a judgment-free zone. We
Yeah.
do not care. we want people to live a happy life where
Yeah.
they're able to function. And if
Yeah.
you're not able to live a normal life because you're in so much pain, like if we're able to help in any way, that's the goal.
Yeah. That's what we're here for. That's what we're here for.
Ugh, sorry. I had hair on my face.
All
So,
right. Well, it was great catching up. Yes, send us messages if you need help, if you want to chat, leave comments, let us know, and we will see you next time.
yeah, and check us out on our YouTube if you Spotify, our TikTok,
Yes.
our Twitter. I still
Instagram.
Instagram. If I'm missing any, remember, we're not doing Apple right now. Apple needs to wait a little bit because to pay for a subscription, I think is kind of silly, but whatever.
Yes, I agree.
Okay.
Yes.
We hope everyone has a wonderful day or night, and we'll see you later.
Bye.
Bye. Wait, how do I do this? No, no. Wait. Leave end session.